Hello, Dr. William Berger here from Northeast Medical Practice. I'd like to take a few moments to talk to you about emerging data regarding the decrease in cancer risk with treatment of obesity. So, for quite some time, it's been known that there are at least 13 different types of cancer that are directly associated with obesity, and these are among the most common types of cancer that we see. However, now there are four different studies in the past year or so that document the decreased risk in cancer by using weight loss medication, in particular the GLP-1 receptor agonist family of medicines. So here we're including both semaglutide, which is a GLP-1 receptor agonist only, and tirzepatide, which is a dual agonist at both the GLP-1 and GIP receptor. So most recently, in the Annals of Oncology, GLP-1 use decreasing risk for cancer, 41% lower incidence of any obesity-associated cancer in these obese patients who did not have diabetes. Really significant difference there. And in JAMA Oncology, and these are some of the biggest journals in oncology, GLP-1 receptor agonist and cancer risk in adults with obesity, a 17% overall decreased risk in developing cancer with GLP-1 use. And breast cancer in particular, this is in a recent paper in JCO Oncology Practice showing at least 30% less likelihood of patients developing breast cancer between the ages of 45 and 80 if they were on a GLP-1 receptor agonist medication. There are also decreased risk of metastatic cancer. This is a paper presented at a recent oncology meeting showing that patients on a GLP-1 38 to 50% less likely to progress to stage 4, or what is known as metastatic disease, for lung, breast, colorectal, and liver cancer. And speaking of colorectal, there's another paper showing 36% less likelihood of diagnosis of colon cancer as compared to patients on aspirin, which is an historical sort of maybe potentially useful colorectal cancer prevention agent. So, how is this happening? We don't entirely know that yet, possibly by decreasing inflammation, maybe by lower levels of insulin and IGF-1, which those things can stimulate tumor growth. It's not entirely clear. However, it makes a lot of sense, right? Because we know that at least 13 cancers, including some of those mentioned there, are associated with obesity, and these are very effective obesity treatments. So just another feather in the cap of these blockbuster and really significant innovations in medical treatment of obesity. So continue to keep our eye on all of this, but I anticipate there to be even more emerging evidence with regard to decreased cancer risk with treatment of obesity with these medications. And then, of course, we have many more medications in the pipeline, including a triple agonist medicine, retatrutide, that is currently undergoing the FDA approval process. So, if you'd like to learn more about how we at Northeast Medical Practice could help you manage your weight and optimize your metabolic health in general, and also help you with your cancer screening, you can reach out to us in the office, 516-604-3418, online at northeastmedicalpractice.com, through our variety of social media channels, including our YouTube channel, and also my LongevityMD podcast on Spotify, where I interview other physicians and clinicians on health optimization topics such as the one we're talking about today. Bear in mind that everything we talk about on these videos is for educational purposes only. No doctor-patient relationship has been formed, and if you have particular questions or concerns about your health, please don't hesitate to reach out to your medical provider. But until we see each other again, we'll keep our eye on all this data and wish you good health.